The health sector could be headed to paralysis in the next 2 weeks if medical workers under the Kenya Union of Clinical Officers make good their threat and withdraw their services from hospitals countrywide. On Sunday, the clinicians issued a 14-day strike notice, setting the clock ticking towards what could turn out to be a double blow to the health sector. This is because the Kenya Medical Practitioners and Dentists Union also has a running strike notice expiring on the same day as the one issued by the clinicians. Caroline Kamau begins our coverage tonight.
We're here to ask the Kenyan government today how many more of us are going to die so that you can realize how dire the situation is.
The healthcare sector is once again mourning after the death of yet another medic who succumbed to coronavirus-related complications.
Today we have lost one of the principal clinical officer from KBC, a very senior clinical officer who until his death has been a teacher, has been an ophthalmology and cataract surgeon working in KBC.
The demise of the clinician from KBC Level 5 Hospital, bringing to 7 the number of clinical officers who have been felled by the disease. According to the Kenya Union of Clinical Officers Chairman Peterson Washira, the loss of lives could have been avoided if the government heeded to the advisories of health unions and those of World Health Organization to exempt from active duty those in the medical field who belong to vulnerable groups.
And we gave them a demand letter, an ultimatum of 7 days, of which they have turned a deaf ear. We have got no response from any of the employers on this, and our vulnerable members especially, they continue to be exposed because of negligence, because this can only be termed as negligence from the employers.
The union has forthwith issued a 14-day strike notice citing hazardous work environment.
That the Kenya Union of Clinical Officers, and by extension the medical fraternity, is deeply concerned and distressed by the unpreparedness and the mishandling of the COVID-19 management by the Minister of Health and the county government, especially in regards to the protection and welfare of the frontline healthcare workers.
In case the employer goes to court, the health workers say they will invoke the Occupational Safety and Health Act and withdraw services until the safety is guaranteed. The union saying they can no longer negotiate on matters pertaining to the sanctity of life for their members. The clinicians' irreducible minimums include provision of adequate quantities of PPEs at all levels of health service delivery, all health workers belonging to the vulnerable groups or with pre-existing conditions be exempted from active frontline duty, provision of a comprehensive medical cover to cater for health workers and dependents, all salaries of universal healthcare staff deployed to counties be paid within the next 14 days, harmonization of health risk allowance. The country has over 2,700 healthcare workers infected with the virus. If the clinical officers make good their threat, the country could face a near total paralysis of the health sector, as the Kenya Medical Practitioners and Dentists Union is also threatening to down tools if the demands are not met by December 6, 2020. Caroline Kamau reporting for Channel 1 News Hour.